So as I said, we will be taking questions. We prefer that you hold questions until the end. We'll have a question and answer period. Uh, During then, as questions come up, feel free to drop them in chat so you don't forget them, or jot them down on some paper, and then we'll address them when we get to the end here. So, welcome everybody, and thank you for attending today's webinar on the Wiser pilot program. So, what is Wiser? It's an acronym standing for the Wasteful and Inappropriate Service Reduction Act. The government definition from the Centers for Medicare and Medicaid Services define it as a reduction model that helps protect American taxpayers by leveraging enhanced technologies such as artificial intelligence and machine learning, along with human clinical review to ensure timely and appropriate Medicare payment for selected items and services. The Centers for Medicare and Medicaid Services often create 5 to 10-year pilot to test ideas designed to improve care and lower costs. If a pilot program delivers the expected results, it can become a standard policy for everyone on Medicare. But officials must first determine that it reduces spending without harming the quality of care or improves care without increasing costs, denying coverage, or limiting benefits. That all sounds nice and well and well intended, but once you learn what Wiser is, it reads like a extended warranty hard sell. So let's look at what Wiser really is. The Wiser pilot model was developed by the Centers for Medicare and Medicaid Services, or Medicare and Medicaid Intervention, which is part of the Center for Medicaid and Medicaid Services, and it took effect on January 1st of this year. The pilot model will run for...
left. Do you want any of it? Want to split it with me?
There we go. Okay. The pilot model will run for 6 performance years from January 1st, 2026 through December 31st, 2031. It affects 6 states, Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. Affects only those that are in traditional Medicare. If you're in Medicare Advantage, you are probably well experienced with denials of service, and this is common in those plans, those privatized plans. It implements pre-authorization for 13 procedures. When it was first developed, it was 17. They've dropped a few cents, and we'll cover those later on. Uses artificial intelligence to predetermine authorization on procedures, with the final decision being made by humans. Now, this final decision oftentimes is simply a rubber stamp to what AI determines as for denial. The problem with Wiser in its core is it incentivizes denials of service by rewarding contractors. And these are the contractors who utilize this AI technology and make the ultimate decision. It incentivizes them with a portion of the savings of the denied service. So paying them based on the program savings that they generate creates a clear incentive to deny care. So that makes it a little more dangerous plan than what the government definition was. Go ahead and step forward there, Alyssa. So why is AI an issue, or why is the Wiser program an issue? It's going to cause more delays, more paperwork, and more appeals. Delayed tests, equipment, or procedures. Delays worsen health and increase out-of-pocket expenses. The prior authorization process is readily found in privatized Medicare Advantage plans already. Medicare Advantage historically struggles with prior authorization process. Adding prior authorization to original Medicare, especially if outside vendors are rewarded based on how much they cut, could make it harder for people to get the treatment their doctors recommend. Low-value services like those targeted in the Wiser pilot program offers patients minimum benefit and in some cases can result in physical harm and psychological stress. And in 2024, Medicare Advantage plans denied 7.7% of 53 million prior authorization requests. Now, nearly 81% of those denials were overturned on appeals, but beneficiaries or the providers challenged only 11% of the 11.5% of those denials. So they're banking on the fact that, especially in the Medicare Advantage scene, that when they issue these denials of service or procedures, that you will not appeal them. And history shows that appeals, or a large majority of the appeals will overturn denials, but few people actually do. So who does the Wiser program apply to? Next slide, listen. Wiser does not affect those participating in Medicare Advantage plans. This process is already part of those plans. Wiser applies only to those who are enrolled in traditional Medicare. And for those who obtain their health insurance through the Public Employees Benefits Board, through the Healthcare Authority in Washington, which are, for the most part, former state employees. This model will not have an impact on those who are already in a Medicare Advantage plan. For example, Kaiser Medicare Advantage plans and United Healthcare Medicare Advantage plans. It will affect those in Uniform Medicare plan with Medicare Part D. And Medicare already has some services that require prior authorization, although they're few. But when these services are covered by UMP, if Medicare denies these, UMP pays, the plan pays as a primary. And those who, this also will affect those who opt for the Primera Medicare supplement plans, Plan F and G. And those who are part of those plans will not be held responsible for services performed that would be later denied. Go ahead and step forward, Alyssa. So let's talk about what procedures are affected by this Wiser model. The key procedures subject to Wiser, and I'm not medically inclined, so I can't answer specific questions on any of these procedures, but these are some of the examples. So electrical nerve stimulators, pain management, such as epidural steroid injections, spinal procedures, cervical fusions, and of those sorts, orthopedic and soft tissue services, such as osteoarthritic knee procedures, advanced treatments, again, nerve stimulation for like sleep apnea, and some others, skin and tissue substitutes for lower extremity wounds, incontinence control devices, and treatments for impotence. Outside of the Wiser pilot model, traditional Medicare rarely requires prior authorization. And it limits it to a few expendable or a few specific items. And we'll cover those here in a couple of slides forward. So I mentioned that there were 13 procedures, and those are covered under these, what you see as these key procedures here. It had originally been 17. So next slide, Alyssa, we'll show you a couple that have been removed. And I'm not going to try to pronounce a lot of this, but treatment for lumbar spinal stenosis was one of the procedures that was removed from this. One that's called CPT 22585, which is a code for an add-on surgery for spinal fusion. And then deep brain stimulation, which is typically used for Parkinson's. And those procedures were removed from the original pilot model. So I mentioned that there are some existing pre-authorizations in traditional Medicare currently. So outside of the Wiser pilot model, traditional Medicare rarely requires prior authorization, but it limits it to just a specific items. They include durable medical equipment, specific high-cost outpatient hospital services, and non-emergency ambulance transportation. And then some Medicare Part D drugs may require prior authorization due to high cost or specialty drugs. And these items are not part of the Wiser pilot model. These are already existing pre-authorization items. So as you proceed, if you get a denial of service, how to determine if it's due to Wiser. And this is important. So Medicare service denial letters stemming from the Wiser model will likely not explicitly state that it's denied because of Wiser in their justification. Instead, these letters will cite the specific reason for the denial based on the clinical coverage criteria. But if you receive a denial for one of these specific high-risk services listed under the Wiser model program, the denial is likely tied to this new program, even if the letter uses standard medical necessity language. So it's the reason we want you to be able to identify these services is in the end is to be able to report this to the Office of the Insurance Commissioner, who is tracking these issues in Washington State, but also to fight the appeal process in doing so. So what is RPEC doing to combat this? In late September, early October of last year, RPEC, along with the Medicare Stakeholders Coalition, drafted letters to each member of the Washington State congressional delegation, urging them to advocate for the removal of Washington from their Wiser pilot program. RPEC, along with the Medicare Stakeholders Coalition, met with the insurance commissioner and expressed our concerns about the Wiser pilot model in our discussions with her. RPEC joined the Wiser State Strategy Coordinating Committee, consisting of organizations from the 6 affected states and also California, as they figured that they were next on the chopping block for this program. And we're working on efforts to stop or at a minimum scale back the Wiser program. RPEC brought Wiser to the attention of ASME in DC, which is now working to garner co-sponsors not only to HR 6361, which was a bill presented by Representative Landsman out of Ohio to ban AI in Medicare, but as well as trying to garner sponsorships for 2 other bills, both sponsored by Washington congressional delegation members. House Bill 5940, which was sponsored by Representative Del Bene, and Senate Bill 3480, which was sponsored by Senator Murray. Both bills are called the Seniors Deserve Smarter Care Act, and they basically ask that the Wiser program itself just be discontinued. And then in addition to that, we initiated an educational campaign for RPEC members to identify and report cases of Wiser denials to the Office of the Insurance Commissioner. And if you remember on the opening slide of what Wiser is and the government definition is it determines the effectiveness of this pilot model program and logging these denials and interruptions in service and potential problems with the insurance commissioner's office will help us all fight that battle to get this program defeated. Um, so again, what is Congress doing? And um, these are the bills that I mentioned. Um, and so the bills have all been introduced. Unfortunately, with the current state of politics in DC, they're really not doing anything as far as moving or being heard in any committees. But we are trying to garner support for all of these bills. So, next slide. What can you do? Um, Stay informed. Um, Seek advice if you're unsure. SHIBA, which is a state health insurance benefits advisors through the Office of the Insurance Commissioner, is a great resource to ask questions. Um, Appeal, appeal, appeal. Medicare Advantage plans deny roughly 17% of their initial claims, but these denials are highly reversible, and roughly 75% of appealed denials are overturned in favor of the beneficiaries and the providers. But despite that high rate of overturns, only about 11.5% of denied prior authorizations are actually appealed, just because people don't go through the efforts. So go through the efforts, appeal these uh, work with your provider to appeal these denials. Um, Report any suspected Wiser denials to the Office of the Insurance Commissioner, and either through their website, through their complaints portion of their website, or through this 800 number listed here. And then reach out to your U.S. representatives. Ask them to co-sponsor 6361. We need additional signers on those bills, and you can reach your congressperson through the switchboard, which will connect you directly to their office, and then ask them again to sign on as a co-sponsor to HR 6361, the Ban AI Denials in Medicare Act. So, with that said, definitely open this up to questions. And I see one in from Paul says, is the cost of paying a corporation to review cases higher than what is saved? Is the cost of paying a corporation to review cases higher than what is saved by denying the procedure? Not necessarily. Medicare services, their payments are set, and using this AI model and just having a human interaction review, it's on the scale of traditional Medicare, it's costing them, cents, or not very much compared to the price of the service that's being denied. And again, they're incentivized to deny it. So regardless of the basis, excuse me, they're going to make money off the denial because they get a portion of the savings from that process. So not only is Medicare having to pay that, but they're or not pay for that service, but that contractor is getting paid to prevent that service from happening. And then is Representative Randall on board for 6361? And at this time, no, there are no Washington members of our congressional delegation that have signed on to that bill yet. Um, is there a list of these services for the CPT code? Um, there is, and I didn't list them here. Um, once we finish this, we'll get this up onto the website on its own dedicated page for the webinar with a link to our presentation. But we'll put some additional links there, and part of the additional links will be a further detailed description of the services that are affected um, by this pilot model program. We also discovered a link to a company that is using AI more as a benefit process that will help you write appeals letters, help you and your provider write appeals letters. So we'll put that link up there as well. Do we know who the contractors are? And Aruna answered that for Washington State, it's Vertex. So yes, we do know who the providers are for each state. What is the best way to get our Congress members to support 6361? Would be, excuse me, I got a bug. Would be direct outreach to them. Again, we put their number on the slide here, and we'll definitely I put it there in chat. That is the Congressional Switchboard, and you contact that number, and they will probably ask you your, if not your address, at least your zip code, and connect you to your representative's office. And once you're connected, just a simple message that is to ask them to sign on as a co-sponsor to HR 6361, the ban denials, AI denials, and Medicare Act. Would it be more impactful if we send letters from the entire chapter? You can definitely do that as well. You know, and you know, we've taken steps to address this as an organization, but the more that they hear, especially from their constituents, when they know that you're constituents, the more likely that they may be wanting to act on that. So I see a few hands up. Aruna, it looks like you were first in line.
Thank you. Thank you for this informative presentation and making the slides available.
Mhm.
My question was they don't call the term denial, but they call the self affirmation for the denial. The language they use is different. And
Mhm.
secondly, in the most recent AARP newsletter, they had a whole article about vagus nerve stimulation, which is one of this procedure that is banned in this Wiser model that helps people who are suffering from arthritis who are non-responsive to the standard treatments.
Right.
So we still have a room to decrease some of the procedures that are included in this, so that next year they're going to add more procedures. So at least if they can pare down this list, it will really help.
Absolutely. Absolutely. And like I said, we'll try to get some links into the webinar presentation post on the website that will further define what these services are. Like I said, it was kind of a high level thing, and I didn't want to flood you with a bunch of medical terminology here, but we will definitely get some links in there that further define what all these individual processes are. Like I said, there's only 13, but they have specific lists of what each one is composed of and examples of that. So as well as actually, I can probably uh, drop that. There's an article that was in the Seattle Times last week, and it was just an outstanding article on some people here in Washington that were facing that have run into this already since the first of the year, and kind of what they've gone through. Trying to find. There we are. Let me drop this. This is just a Word version. I mean, it's in PDF, but it's just kind of captured the text from the article. But the person that wrote this did a tremendous amount of research on the program, and then interviewed a handful of people and they each kind of described what they were going through and what they faced running into these denials and how it affected them. So it's a great source of information. We'll put this article on the website as well. So more information as people are running into this is starting to come out, especially press coverage. Can we have a link in the chat that helps doctors and consumers appeal the denial? Yeah, let me see if I can find that. While I'm searching for that, Bill, we'll go ahead and jump to your question.
Okay, thanks. I just wanted to double check. So, in this situation with traditional Medicare and Primera, would I receive a denial letter, or if the doctor's saying they're denying something, but I should still receive a doctor's letter, or I mean a letter to deny the procedure?
You would still receive a letter from Medicare stating that the was denied, but chances are it will not say because of the Wiser pilot model or anything else.
Right.
It'll just read as a standard denial of service letter.
Because in general, the paperwork from Medicare takes a while too.
It does. So that again is the problem. Is a lot of this is affects people's lives and their health and everything else, and waiting for this process to go through. Nice thing about this process is if your provider determines or decides to go ahead with this prior to any pre-authorization happening, and Aruna, I think you can correct me if I'm wrong, but I believe that you are not held responsible for the cost if it's denied. It's the provider that or the insurer that's at risk once that happens.
And I think actually this is with my spouse, but do they who can appeal it or should appeal it? The patient or the doctor or both?
Ideally, it would be the patient, but you can definitely work with your provider to draft the denial, and because you're going to want your provider's input on this as to the justification for the need for this. So you're going to need their input, because you're going to want them to justify that this is needed for your health, needed for your quality of life. So you're going to have to work with a provider. And Aruna had mentioned if I could drop in chat to help with the denials process. And this website that I just dropped in is called Counterforce Health. And it was developed made by patients, doctors, and caregivers. And like I said, uses an AI tool to help draft appeals language for you. And I believe this is just getting going, but it's got some good some good background to it. But it'll definitely help you get started in the appeals process of going, and it's a free tool to use. So
is there also, I think on the, well, I haven't seen a denial letter. I see some of the regular statements, but in the denial letter, do they actually tell you the process for appealing?
I have never seen one, but I imagine that they're probably required to at least let you know the process to appeal if you should. So um,
Okay,
you know,
thanks.
if anybody comes across it, I'd definitely love to see a sample of one if you ever receive one, just to know
Right.
how they read. Or if you get them, if you're in Medicare Advantage, which, like I said, this was geared towards those in traditional Medicare. But if you're in a Medicare Advantage thing and have received a denial letter, um, you know, we'd love to see a copy of that. And you can black out any personal information or medical
Mhm.
information that you feel should be prevented. But if we can just see at least the format of the letter, that would be helpful. You know, but we
Mhm.
don't need to see your personal medical information at all. So
Okay.
feel free to black all that out. So um, yeah, Runa said that doctors are typically notified first because
Mhm.
they're putting it in the system. They get the notification. So um, probably long before you get a letter, your doctor would be notified that your service has been denied, and
Mhm.
then you can begin working the denial process through with them. So
Yeah.
um, Judy, thank you for jumping in here. It's important to recognize that the wiser terminology for denial is called a non-affirmation, as Aruna had stated. So, yeah, it's not always saying your service was denied or anything else. They're going to use very polite language in this process. Uh, like I said, such as non-affirmation. So,
Also, this is Aruna. If your doctor says they have, referred you for this service, and within a reasonable time, a week or 10 days, depending on how urgent it is, if you don't hear back from the doctor's office, then you want to follow up with them rather than waiting, just so that you get the intervention in a timely manner. And the other thing is, WISE-R is not applied to patients who are in the hospital or in emergency department.
yes, thank you, thank you. Um, like I said, we've been working on this. Or we have a work group called the Healthcare Work Group, which has been uh, looking at many issues on this. Aruna is well versed. Uh, Judy Finn, who's on this call, is well versed. Um, so it's we have people that have studied this more. I am planning to put together a webinar just on appeals. It's a rather in-depth process, but there's a lot of information. And, I mentioned some statistics that, a high percentage of denials are successfully overturned through the appeals process. So I am planning to work with our healthcare work group on developing a webinar just on the appeals process. So, watch for that in the future, and hopefully we can revisit Wiser with some additional information. But we will continue to update uh, this post on the website featuring this webinar with information as we come across it. But also, please visit our healthcare resources page, which our healthcare work group spent an enormous amount of time putting information together for us, and we're very thankful for them. But there's a lot of outstanding information um, on not only Medicare, Medicare Advantage. There's a whole section on appeals. We just put a letter or an article by them in the most recent newsletter, which should be in the mail soon to you. That post is also on the website, and it was featured in last week's news flash as well. But there's also information there on places to reach out to with questions like Sheba or the insurance commissioner's office, etc. Aruna.
Um, if I understand right, the appeal process for Wiser is different from the appeal process for Medicare Advantage denials.
Yes, it's with the Wiser program, you're appealing directly to the to the Center for Medicare and Medicaid Services, which administer the core of Medicare, that's where the denial is going to come from. Whereas Medicare Advantage, you're appealing to the provider or to the contracted insurer for that. So the appeals process is different. You're going to the government instead of to a corporation in the sense. So the chances for overturning could differ with this as well, but that doesn't mean to not attempt that with your provider. Bill.
My suggestion is that down the road with the healthcare work group, that you actually publish some appeals, take out all the personal information, and put a whole a group of sample appeals up.
Mm-hmm. We can definitely do that because we have actually a pro on appeals that heads up the healthcare work group, Matthew Groshong from Chapter 3, has fought many denials through his insurance provider and has successfully won a number of those. So I'm sure he can provide samples and some background as to that process and what that looks like. And like I said, a lot of our healthcare work group members have spent a lot of time not only experiencing this, but researching it as well. So, like I said, I do plan to have them work on a webinar just on the appeals process for the near future. So, but excellent suggestion, Bill. So, Runa, did you have another question, or is your hand still up?
No, I'm sorry, I forgot to take my hand away.
Okay, not a problem. Not a problem. Any other questions? And Jordan published the link to the healthcare resources page in there too. So there's, like I said, that's chock full of information as well, and in addition to information on who to contact for various things. So this whole thing is going to be a learning process, not only for for patients, but providers as well. When this program kicked off, nobody was really ready to administer this program or handle this program. So, there are bugs in this model. But they're going to have time to try to work it out. As Aruna said, as this continues, there's a likely chance that they're going to continue to add more procedures to this pre-authorization list. And there could be a chance that as it continues, they continue to add states to this. So, so we'll be continuing our work to try to fight this program. It's like I said, they defined it as trying to stop wasteful and inappropriate spending. But if you look at cases of fraud or abuse in the Medicare program overall, most of it stems from the Medicare Advantage plans. And that's been historically shown as far as waste and services. So, but they're not going to punish large corporations for what they're doing. They're going to, in the end, basically punish the end user, the patients. So, any other questions about this?
Thank you for this presentation.
Yeah, absolutely, Aruna. It was, like I said, we're not pros on the medical aspects of this, but we want you to be aware of this program. We want you to be aware that this is happening in effect, and to not only to fight any denials of service that you encounter, but just be aware of them. But we also want you to be able to report them, when you encounter them. And so that's why we listed, what are some of the common pre-authorizations that are in Medicare currently, so that you can identify that what you might come across is related to Wiser. And we do want you to share that with the Office of the Insurance Commissioner so that they can gather that information, and they're making an attempt to fight this in DC as well. So, and they're working with the other states affected by this, with the other insurance commissioners to fight this. Aruna, did you have another question?
Yes, I think to emphasize the point you're making, the data is going to help the insurance commissioners to fight it in Washington, D.C., because they have the national organizations of insurance commissioners, and we have brought it to their attention also. And our reporting to the Office of Insurance Commissioner in our state is going to give, Commissioner Kuderer a chance to have the necessary data to be able to present the case more strongly. So
Exactly.
our help is needed too, so that they don't add more procedures.
Exactly. So every little thing that we can do to not only help them, but to kind of stand up to this to this program, because in the end, it's another attempt to push this towards privatization, to create means for insurance companies and their affiliates to basically to make money off of low quality service or denial of service to the end user, to the patients. Whereas the money should be used for healthcare. Bill. You're muted still, Bill. Okay. Yeah, if you're having trouble with that, if you want to try to just drop your question in chat, we can try to address that too. Or if you become unmuted, just jump in. But I appreciate everybody stopping by today. Hopefully this educated you a little bit on Wiser and what it consists of and how it could impact you as traditional Medicare beneficiaries. If you have any questions along the way, feel free to reach out to us. Billy, I saw you come unmuted there.
Okay, I'm back on.
Yeah.
There's absolutely no role that a Medigap insurance provider plays in this process, other than that they sit back and get the profit from it, right? In other words, I have had some success by going to my Medigap provider to complain about stuff. and they have helped sometimes.
Yeah, it's Medigap's really not going to profit. Any provider for Medicare is really not going to profit off of this. It's the contractors that have been chosen by CMS, because this decision is being made by Medicare, not the Medigap providers. This is being decided at by Medicare overall. So these are processes that their contractors are going to benefit from. These contractors that are using the AI technology and making the denial of service decision, they're the ones that are being paid a portion of the savings that Medicare doesn't have to pay that. So, yeah.
Okay, that answers that one.
Right.
But,
Right.
I was going to add one more point to the previous point about publishing sample appeals. I would also pass that suggestion on to the coalition, and have these other groups, perhaps start collecting samples of appeals so people can see them.
Yeah. Yeah. No, definitely. We will build out that process. And just to one more point with the Medigap plans is your Medigap provider can elect to still cover this service, but they would be doing it at risk of not being reimbursed by Medicare for doing such.
Okay.
So so they're kind of in the same boat. They can say, yeah, your Medigap provider can say, we feel that this is necessary, we're going to cover it, and then the authorization kicks in, and they're at risk for the cost of that. So, yeah, if there's not any other questions, again, thank you all for stopping in today. Hopefully this was helpful to you, and you may have learned a little bit about this program. Like I said, I put the article from the Seattle Times in here. It's an excellent read on how this has actually affected a few individuals in our state since this went into effect, and kind of it gives you some insight as to the process that they've gone through. And a lot of these were services that they've already been them and their provider have been using to maintain their health, to maintain their quality of life, and how it's impacted them. So it's a good read, and we'll definitely put that article with this post, with this video, on the website. So again, if you have any additional questions or run into anything, feel free to reach out to us. And if we can answer it, we'll definitely point you in the right direction to get an answer. So thank you all for stopping by today. And we'll get this up on the website probably within a day or so, and with the additional information for you. So have a great week, and enjoy. Thank you.
Thank you.
Thank you. Thank you.